to LATIN-19. For those of you who are joining us for the first time, we usually start at 12:03. As you're joining us, please make sure to go. There is a little globe at the bottom of the screen that shows language interpretation. And we want you to please check that little globe and choose your language of preference. If you're going to be speaking and listening in Spanish or prefer to speak and listen in English, choose your language of interpretation. Para los que se están encontrando ahora, sabemos que siempre comenzamos a las 12:03. Les pido que por favor vayan entrando a el globito que dice interpretación y vayan eligiendo ya sea español, si el español es su idioma principal, o inglés, que tenemos a nuestra excelente interpretadora que interpreta de manera simultánea todas nuestras presentaciones. For those of you who are joining us, we usually start at 12:03. Please choose your language of preference. If you're English speaker, choose English. If you're a Spanish speaker, choose Spanish, because we often will have, especially during the question and answer period, we will have questions and answers in Spanish or English. We are streaming live on our Facebook page today. We are really excited about today's presentation. Okay. All right, it's 12:03. For those who are joining us today for the first time, once again, we want to make sure you know we have simultaneous interpretation, and we would like to make sure you choose your language in the globe that it is at the bottom of the screen. We will start in just a moment, just allowing people to join in. I am Dr. Viviana Martinez Bianchi, and I want to welcome you all to our 23rd month of LATIN-19 meetings. For those who are new with us today, the Latinx Advocacy Team and Interdisciplinary Network for COVID-19, LATIN-19, is an interdisciplinary multi-sector coalition that works to reduce health disparities and health inequities within the Comunidad Latina in mostly the state of North Carolina, but we know we have influence and we have visitors from all over the country often to our meetings. More than 1,200 people have gone by and registered to our LATIN-19 meetings, and we continue. We are beyond belief. It's amazing for us to see how often we continue to meet at our 80 to 100 people at these meetings after 23 months. The original mission of LATIN-19 was to reduce the negative impact of COVID-19 on the physical, mental, and social health of comunidades latinas. And that mission has now expanded to ensure that the health and wellness of diverse Latino communities, both now and going forward, post-pandemic, are improved. And we are basing on lessons learned through the COVID-19 response to continue on doing all of this work. To do the work we're doing, LATIN-19 leverages the strengths of pre-existing community partnerships while fostering new collaborations that have been emerging in response to the pandemic. These meetings and our collective participation and action in response to what we learn during the meetings and what we do later is what makes our work noticeable and successful. And so before we get started, I want to thank so many of you who have been joining us almost every Wednesday here and in the action things that we continue to work on. Today, we have the honor of hosting an exceptional Latina and global health and equity advocate. And I would like to introduce Dr. Gabriela Maradiaga Panayoti, pediatrician extraordinaire and co-founder of LATIN-19, to introduce our speaker. Dr. Gabriela, my dear friend, mi querida Gabriela, floor is yours.
Hi, everyone. Buenos dias, buenas tardes. It is such an honor today to introduce Dr. Elena Bottazzi, another fellow Honduran. So proud. I've got my little flag here just for the moment. To our meeting today. Viviana, can you hear me okay? Yes, okay, wonderful. So Dr. Maria Elena Bottazzi is Associate Dean of the National School of Tropical Medicine, Professor of Pediatrics and Molecular Virology and Microbiology, and Division Chief of Pediatric Tropical Medicine, and co-director of Texas Children's Center for Vaccine Development at Baylor College of Medicine in Houston, and Distinguished Professor in Biology at Baylor University in Waco. She is internationally recognized in tropical and emerging diseases as a vaccinologist, global health advocate, and co-creator of a patent-free open science COVID-19 vaccine technology that led to the development of Corbevax, which is a COVID-19 vaccine for the whole world. She pioneers and leads the advancement of a robust infectious and tropical disease vaccine portfolio, tackling diseases such as coronavirus, hookworm, schistosomiasis, and Chagas that affect disproportionately the world's poorest populations. She also has established innovative partnerships in Latin America, the Middle East, and Southeast Asia, making significant contributions to innovative educational and research programs. She catalyzes policies and disseminates science information to reach a diverse set of audiences. As a global thought leader, she has received national and international highly regarded awards, has more than 180 scientific papers, and participated in more than 250 conferences worldwide. She is a member of the National Academy of Sciences of Honduras and an emerging leader in health and medicine of the National Academy of Medicine in the US. Dr. Bottazzi has received national and international highly regarded awards, is a fellow of the American Society of Tropical Medicine and Hygiene, the Executive Leadership in Academic Medicine, the Leshner Leadership Institute for Public Engagement, and Senior Fellow of the American Leadership Forum. Forbes Latin in 2020 and 2021 selected Dr. Bottazzi as one of the 100 most powerful women in Central America. Dr. Bottazzi has served in National Academies ad hoc committees and serves as co-chair of the Vaccines and Therapeutics Task Force of the Lancet Commission on COVID-19. And of course, in this year, 2022, alongside the wonderful Dr. Peter Hotez, she was nominated by Congresswoman Lizzie Fletcher of Texas for the Nobel Peace Prize. We are so excited to have her here today and learn from her and have a conversation about vaccines and health equity. What an amazing honor. Bienvenida, doctora Bottazzi. The floor is yours.
Muchas gracias, Gabriela. Thank you, everyone. I think I'm going to try to do this as much Span-English as possible, but I'm going to probably focus in English, but como hablo también español, así que no tengan pena de ponerme mensajes o preguntas. Y es cierto, pues para todos los hondureños que estamos por ahí, pero todos los latinoamericanos o que tenemos raíces latinas, pues gracias por unirse al LATIN-19. Tengo que decir que basados ustedes en North Carolina, ¿no? Me imagino, no sé si toda la audiencia es solo de North Carolina o de todos los estados de Estados Unidos, pero tengo mi corazón muy cercano a North Carolina. Mi hermano vive en North Carolina, vive en Winston-Salem. Él fue el que pues no solo me puso en contacto y he conocido varios de ustedes vía mi hermano y vía amigos de mi hermano, así que un shout out, no sé si él estará en la audiencia, pero él es el director de las clínicas Libot en Winston, Greensboro, Raleigh-Durham, creo que por todos lados. Y así como yo, pues muy interesados en acercarnos a la comunidad, hacer estas conectividades, to be connected with all of you, provide as much, conversation points and really be able to share our story. So I think today I'm going to then focus, I'm going to share my slides just so that you can see at least some colorful slides. And I'm going to tell you a little bit, I think it's going into slide presentation. My computer is just, there you go.
One moment. While Dr. Bottazzi is about to start, please look for your language of preference on the globe at the bottom of the screen. Those who joined after we had started sharing that information, we have simultaneous interpretation. So If you speak English, please choose English. Si hablan español, por favor, elijan el botón de español abajo. Doctora Bottazzi, muchas gracias y adelante.
Gracias, muy bien. So I was asked to give you a little bit of the story of, you know, what has been happening in this 23 plus months, and probably for us even before that. We've had 10 years of working on coronavirus vaccines, but the behind the scenes of how we been able to participate in the development of a COVID-19 vaccine that we are calling the vaccine for the world, but also bring you a little bit the perspective of how we, our philosophy is this concept of intersection of not only open science, removing barriers, and of course, diplomacy. So I want to just start with just telling you a little bit of the fact that I think you probably are very aware that you all that work in the area of the health sciences, in whatever role you may have, that, you know, the 21st century have really shown us that pretty much global health is a game of whack-a-mole. You know, we are really getting impacted by many forces, right? Of course, the diseases themselves, the pathogens that cause the diseases, whether they're, you know, infectious diseases or even diseases that are, of course, non-communicable, right? You know, we have so many diseases that are really come from the fact that are just, you know, diabetes or cardiovascular diseases or others. Now, on top of that, we have emerging diseases that, you know, we are seeing the devastation of what they cause. The good thing is that in that framework, one of the, you know, attempts of the United Nations around the world is that we've been working under the framework of what we call the Millennium Development Goals at the beginning of the century, and now, of course, the sustainable or the global goals, which clearly have highlighted that the global problems are very audacious. Many of them, of course, have the underpinnings of health being, you know, certainly at the center stage. But we have so many, you know, problems that we have to address. That again, we have to, all of us, put it in context of how each of our activities on a daily life are, of course, contributing to play in this whack-a-mole game. And I think what it has also been exacerbating and influencing, you know, how, of course, we navigate through our daily lives in how to reach equitable health or how to address problems that are really very close to our communities, is all these what we call the social forces or the Anthropocene forces that, of course, are mostly man-made forces, right? The fact that we are clearly struggling again with the equity at all levels, including, you know, world poverty, the fact that we have so many instances of conflict, driven, of course, by a lot of not only political but economic conflicts, that fact that we as humans are impinging into the world by, of course, you know, through migration, through population growth, through urbanization, you know, we are influencing also the changes of this landscape of not only climate, but also how pathogens have to adapt, how vectors have to adapt. So clearly we're not, you know, working in a field that is easy. But we all can certainly contribute, right? And, you know, we've seen it, how many of these forces have now brought us to almost to a point where I don't think we maybe even remembered, certainly our young generations have not remembered of how pandemics can bring to the knees, you know, our societies. But now we've seen it with COVID-19, where we clearly see, you know, so many deaths, you know, an enormous amount of people having been burdened by, you know, the disease. And we also now don't really know yet the long-term consequences. And certainly how the virus and the disease have brought us, you know, to a real disruption of global economy and many other aspects. And of course, I'm not going to probably convince you, but you probably agree with me that throughout generations, we now know the value of vaccines in public health. And, we have a whole a group of diseases that have been even, practically eradicated, and certainly are very well under control and have averted so many deaths and so many, of course, sick people. And in the context of coronavirus, of course, we now know that we have a very hefty portfolio with many more that started, with the aspiration of getting to the point where they could be, of course, evaluated and authorized. But there still seem to be a pretty big, large inequity gap. And even though you may arguably say, how on earth with 19 different vaccines being authorized, how are we still seeing an enormous inequity gap in not only access, but certainly also acceptance of these vaccines? And the reality is the following, right? That we have really not done a very good job at, selecting what to invest into, what technologies. Many of these technologies, even though they have been very good and that we have, most of us, even be beneficiary of those technologies, as you can see in this graph, these technologies have not really reached the corners around the world that, most likely are in great need. And that's clearly by the fact that we still have almost 3 billion people that have not even had the chance of receiving not even one dose of vaccine. And then, of course, the complexities of how the virus has taken advantage of this. Variants have evolved. And now even in our own countries, we're being faced with boosters and how many boosters and when to give the boosters, what populations should we be vaccinated, the expansion of clearly the need that is not only high-risk populations or first responders, that we need to also include, of course, pediatric and even women, pregnant women and other, very special populations. So clearly we have to vaccinate the rest of the world, bring vaccines that can be sustainable in the event that we need to have these additional doses and boosters, and even not knowing how sustainable we're going to need to have these booster approaches, vaccines for pediatrics, broader and long-term protection. And we even do not know. We've seen already a trend that coronaviruses tend to arise every certain, cycles around, time. And we've now in the third of the coronaviruses have been able to jump into, causing outbreaks and pandemics. So we really need to be cognizant. So we have to address this, not only today for the urgency, but also in the long term. And that brings, of course, there's many models, business models of how you approach vaccine development. We actually are trying to break one of the paradigms of vaccine development of, traditionally relying on high-income countries being the ones who lead these types of development programs, that we only take into account that big multinational companies are the only ones that certainly could play a role, bringing, again, a little bit of more balance in this, ecosystem of development. And so our vaccine center, who now has 20 years in operation, was created with a concept of breaking this paradigm by a couple of things, right? One, working in this concept of partnerships, which was brought in fact, in the original development goals, in the Millennium Development Goals, which is through partnerships, not only by bringing together the North and the South, the East and the West, the low, middle, with the high income countries, that through partnerships that we could really advance research and development and innovation. But we also doing it also by not only looking at appropriate technologies, affordable technologies, of course, they have to be safe and effective, but doing it also with the concept of building regional, local, indigenous capacity in the places where we want these products to eventually come and solve the problems, and therefore doing it through policy advocacy and hence diplomacy. So this is the story that I'm going to tell you. And the reason why we thought of this potential, new paradigm of vaccine development came from the fact that, Peter, myself, and certainly our institutions and our scientists we were just fascinated by these bugs that you see on the screen, which are all these tropical diseases or bugs that cause these tropical diseases that unfortunately they have a very very specific characteristic. They tend to always afflict poor people. They are usually found in very remote rural areas, and by no means only in low middle income countries. Now we're seeing that we have a lot of these diseases also in the pockets of poverty within the high income countries, which of course are also neglected. And most of the times poor populations end up being, Latinos, people of color, and certainly those are the populations that are underserved within our communities that don't have access to health. And it's this cycle of poverty, right? If you're poor, you cannot have access to health, have access to education. You are not productive in society, so that therefore you stay stuck. And these bugs take advantage, and therefore, of course, set chronic, long, debilitating diseases. So we knew that nobody was going to have any economic drivers of developing solutions for these types of parasites or diseases. So we needed to look for alternative strategies, and that's how the concept came through. And therefore we have been advocating for the last 2 decades for this framework of vaccine development and this concept of that Peter coined, this whole blue marble health. And it's the fact that it really was taken from, in fact, when our astronauts were looking at the Earth from up in the space and seeing how our world is not equal, right? It's patchy at all levels. And in fact, that most of these diseases again are living within the poorest of the rich, right? And so therefore we need to adapt our framework of really emphasizing the need of getting to health equity, advancing international diplomacy, but doing it in a way that it's with fraternity and solidarity, and enhancing this cooperation, but doing it also with being very flexible and transformational, and not looking at things transactionally, just with putting band-aids in the moment that we need to react to something, but really have an effort to really build on how we can proactively influence change, and influence change that we of course can sustain. And be honest, we even wrote a paper really early on, in April of 2020, where we even, being in this space of tropical medicine and neglected tropical medicine, we even co-wrote an article, and Peter even wrote a book on, is COVID-19 going to become the next neglected tropical disease? And in fact, we already knew coronaviruses were neglected, and that's why we adopted it into our portfolio, because unless we have an emergency, nobody was really caring about this. But the fact that COVID-19 has brought out a lot of failures, the fact that we are not only seeing, of course, the levels of mortality, but we don't know the levels of morbidity that will cause in the long term. We saw how even in high income countries, we really were not prepared, and that our health systems really collapsed. That this also had an enormous burden, and the fact that all the goals that we were advancing quite nicely in the millennium and then global goals, we saw huge interruptions in public health programs. And now we're seeing a huge decline. And in the area of vaccines, including for pediatric vaccination rates. And we're now going to be able to see a lot of repercussion on that, and including the compounding effect of this pandemic on other diseases like flu, and of course other vector-borne diseases. So again, we kind of a little bit predicted this was the case. So to wrap up and to open it up, how we can engage into a conversation. So what exactly is our model, right? So we agree, of course, we are in the US, and we of course have the benefit of access to not only some maybe even funding sources, or even curiosity with institutions that are like-minded. So We agree that what we do, everything is with the concept of creativity within designing everything here in our laboratories, but by inviting into our consortia, certainly equitable representation of who eventually we want to hand off, and share our know-how. And we do it, of course, with very rigorous technical and scientific, framework. Of course, science and evidence really guides, our decisions. Adapting with a mindset of a very stringent quality, not only assurance and documentation practices, meeting all the regulatory, ethical, legal considerations, building a business case that clearly shows the value of then these transfer of technologies, of course, would be able to be replicated and adapted, and allowing them, them meaning, where these technologies need to be co-developed to follow their rules and their regulations, which of course, are to meet the needs of the populations that they're going to be deployed. And we, of course, there's a very interesting group that maybe you all are not aware, but there is what in fact they are called the Developing Countries Vaccine Manufacturing Network, which represent many regions around the world which are aspiring to indeed play in this global access space. And they, to be honest, are probably one of the networks that are the ones who provide many of the vaccines that are eventually reach our Latin American countries, as well as many of the low middle income countries. So the way we do it then is we do open science, we remove barriers, and the way that we do is very simple, right? We publish everything. So honestly, if you want to do the work that we do and replicate our work, you as easily as just read our papers, and you don't even have to call us. You have free information that you can replicate what we do. But we also can provide added value, right? So we can basically give you literally a box, a drop box, and a Zoom link where we basically give you the starter kits of course, our creativity and all our technology. In this case, of course, we use this vegan technology, which is using yeast to produce, in our case, the vaccine prototypes. We give you a Dropbox with all our recipes and all our regulatory enabling documentation, with all the tests, to make sure that you can control and do the quality, evaluation. And then again, a Zoom link, because we, of course, are here 24/7 to answer any questions. And I think this is where ultimately it became the aha moment, I have to say, that the global community received when we explained to them our partnership with India, of where we have an open science, no patented, open source vaccine, construct, recipe, and of course Zoom link, where we are, of course, now have been able to license Corbevax, which is our first example to achieve this vaccine for the world. And similar to how we did this exercise with Biological E, which is our partner that brought to the creation of Corbevax, and Corbevax is Biological E's vaccine. Right now it's India's vaccine, indigenous vaccine. BioE, of course, is aspiring to get all the permissions to open it up to share with the rest of the world. But we are having a snowball effect. Very soon after we started working with BioE, we started working in Indonesia with Biopharma. Our products are also halal ready, meaning that they also fit very good culturally, intelligently, in of course, many different requirements. We're working in Bangladesh with Incepta. We're now working with a group led by Immunity Bio, which are building infrastructure in Africa. And as you can see, now we're grabbing the interest that, especially in a case where we, of course, need to have a new model during an emergency to reach equitable, not only production, evaluation, but eventual distribution, that, it seems that this seems to have received some good attention. And we're hopeful that the attention will stay for long times, that it would actually retrograde and come into play in our neglected tropical disease vaccine portfolio also, so that we can really see a change again in paradigm for vaccine development. And I think that is what I have to say. And just to thank you for the opportunity, I think to just put in front of you probably things that you also are quite like-minded, where you have to have integrity and altruism in sometimes the decisions that you want to take. You have to build trust relationship. You have to be culturally intelligent. At the same time, you have to be adaptable and flexible. And therefore, these that you see in the screen are our guiding principles. And leadership success is really measured by the influence you have on others. So I appreciate the opportunity of being part of LATIN-19 and debrief you on who we are and our philosophy, and look forward to any questions and comments.
Thank you very much for a great presentation. I saw that there were already some questions. One of them, there is a comment that comes from your own brother, from Gabriela Bottazzi. Here, Gabriel, did you want to unmute and just share your thoughts?
Well, her specific thoughts of the science around what she's been doing and the intentions, I cannot comment because she's a lot smarter than I am. Obviously, she took all of the smart genes of the family. I just want to comment how proud I am of not only what she does, but how she does it and how she gives it to the world. Es un orgullo para todos nosotros, mi hermana.
Gracias, Gabri. Y obviously, I made a plug for what you're doing too, because with all in all that you're in the realm of business, you opted for creating a business that also has that intent to give back, right, to the communities, the Latino communities in North Carolina. So I'm also privileged to be related to you. And it's true, you taught me to be who I am, and hopefully I taught you how you are, and we all gained it from papi and mommy and sisters and everybody.
Wonderful. There was a question earlier on, kind of perhaps asking for clarification from Marcela Sarsotti Calso in the chat, said non-transmissible diseases. Perhaps you would want to share a little bit what it meant in that slide. I have my thoughts, but Maria Elena, if you want to share.
Yes, so we have also be very interested in the interplay, right, of how being sick because you are exposed to pathogens, right, also exacerbate, what we call the diseases that are, of course, not caused by, pathogens. Because of your inherent genes or your exposure to environment or your way of life, right? Certainly obesity, smoking, genetic factors, again, that lead you to maybe have cardiovascular propensity for certain types of diseases. We now know very much that the influence of how these pathogens influence your body, right? Like example, Chagas disease, which is transmitted by, of course, a bug, and that it's a protozoa that ends up living in your heart tissues, clearly has a bearing on cardiovascular disease. And if you on top of that have genes that you get propensity of cardiac disease, having that on top of Chagas makes it even worse, right? So I think that's where the interplay, and therefore when you study, maybe you are involved in helping your communities to educate of how to, do better health by, exercising or by eating better or by ensuring that they keep in check your heart, or your blood pressure, ultimately is important, because if you put it then in context that then when you get exposed to these diseases, you actually can probably get rid of them easier if you, of course, also have underlying health risk factors.
Thank you.
There is a comment from Monica Johnsons. Do you want to share, Monica, your question or comment?
Sure. Can you hear me okay?
Perfect.
All right.
First of all, I just want to say thank you for the work you've done and what you're continuing to do. I actually work at Duke University in vaccine development. But what I really wanted to know is, like, I only heard about you in the promotion of this series. And as a Black woman, I've seen the hesitancy in our community and our family, and so what I feel like is I don't see the promotion of what you've done. I hear about, Pfizer and Moderna. How do we expand the knowledge of all the work that you're doing and women like you and people of color to help with this hesitancy that we're seeing in our community and not COVID, but, flu?
You're absolutely right. And I honestly have to tell you that throughout the, not only 2 decades of working in this field, but certainly in the last 23 plus months, it's not been easy to be upfront and people listen, right? Because they are obfuscated by certainly a lot of misinformation and disinformation and whatnot. But we try, right? And I think it's groups like you, and in fact, very interesting, just for your personal information. Yesterday, I gave a really nice presentation to another group that was combining. It's a group called Vaccinate Your Family that partner with the NCNW across all states in the United States, and especially during, of course, Black Month. We are, of course, building, to bring in the voice, not only, of course, to the Latino communities, but also to the African American communities and, the Asian community. I mean, so we do as much as we can. Of course, me and Houston have been invited in many, public announcements in our radio stations and do community roundtables. But you're right, we need all of you to amplify this, right? And present the fact that, yes, we have to connect better with, with our communities. And scientists, have a tradition of not being very good at it. So I think that's another thing that that we aspire within our academic institutions, to train the next generation to take science engagement more seriously, and therefore communicate better, right? And so I appreciate that yes, it's something we need to work on. But you are our champions, right? So, to amplify our voices.
Tengo una pregunta de Pedro Gómez Altamirano. Pedro.
Hola, Dr. Maria Elena Bottazzi. My name is Pedro. Thank you so much for the talk. It was super informative. I do have a question about the model that you have and then the model that COVAX has. From my understanding, COVAX basically gets funds from wealthier nations and then buys batches from the pharma companies and the manufacturers at a reduced cost than compared to directly from countries. But your model doesn't have any patents. I would assume a little bit lower cost, but can you speak on the cost, the manufacturing implications, the equity implications, as well as not having to worry about patents and maybe the different frame shift that you're proposing versus the COVAX model that has to rely on?
Sí, muy importante, y para aclarar, el COVAX es un programa que prácticamente es como un espejo también de cómo las vacunas eventualmente llegan a los países en vías de desarrollo. Por ejemplo, las alianzas de Gavi, ¿no? del Global Alliance for Vaccines, y trabajar similar, por ejemplo, en Latinoamérica. La manera como se refleja es con el fondo rotatorio de la Organización Panamericana de la Salud. Entonces, la intención era justo eso, era recibir vacunas que son subsidiadas y después permitir ya sea una manera de cómo distribuirlas equitativamente alrededor del mundo. The problem was that first of all, I think nobody really recognized that the pandemic was going to become global, that unfortunately the virus was going to vary, and that the fact that COVAX was only going to help up to the first 20% of populations was going to be enough. And therefore, even though they struggled because the inventory wasn't there, in theory, many countries, have received their allotted share through COVAX. Pero el resto de los 60, 70, 80% de las vacunas, the countries were going to have to deal with them and purchase them themselves, right? And so when they were faced with the fact that unfortunately there was a poor selection of technologies, that one, they were too expensive, that we couldn't make enough, and that ultimately, because we need more and more, and now with boosters and pediatrics, and we're going to need more and more and more, there's just no way that with COVAX alone, with just the vaccines that we have available right now, we're going to be able to fill that equity gap. And that's why we still have such a need. And that's why that at the beginning, we kept saying, don't only focus on these new technologies, because albeit they're fabulous and they work, they're not sustainable, they're not scalable, and they're too expensive. And they cannot even be made locally today. They're already building that infrastructure. Maybe 10 years from now, they'll become conventional. But today, to solve the problem, they lost the perspective, and they neglected to keep around the table other technologies. The Chinese tried it by bringing the whole inactivated vaccines, which at the beginning also were pretty good. Now we're seeing they're not that good anymore because of the way the pandemic has evolved. But the protein-based vaccines were really nowhere to be seen. And honestly, we still are a little bit in awe of understanding what was the real driver of why they were not selected, when we had much data supporting that they were going to probably work. And now we're seeing it with Corbevax. We're going to see it with others. We're not the only ones, of course, advancing protein-based vaccines. There's others, but now we're stuck. We're stuck because the world doesn't have a path towards rapidly bringing them to the world. The WHO doesn't have a framework right now to enable the approvals. So the approvals are going to have to be dependent on, for example, India approved for India. Now we need to figure out how India can enable their approval to be accepted outside of India. And so we are, of course, working with WHO. We are working with agencies. We are working, in country by country, showing the data, showing the evidence, right? But it's a shame because we need vaccines now. We don't need vaccines, next year, right? So, but, that's many lessons learned that, of course, but COVAX it's a good attempt, but it was still very limited. And so that's why we had to look for other ways of how to address the equity gap. So maybe in the future we can resolve that.
Thank you. We have questions from Maru Quinteros first, then Nurka Taro Díaz desde Cuba, José Antonio Sar Ortiz, que creo que nos une desde México, y luego Sirana Bert desde aquí de Carolina del Norte. Maru.
Gracias, doctora Viviana, por la oportunidad. Encantada, doctora Bottazzi, de su presentación. Realmente es como un rayito de luz más allá de lo que uno pueda ver, porque uno no está involucrado en su mundo médico y en el impacto que este puede lograr. Mi pregunta es la siguiente. Lamentablemente el mundo político es lo que maneja muchísimas cosas, la gran parte de nuestra vida, y obviamente eso habla de la salud pública. El mapa donde usted nos muestra la gran disparidad, mucho más de lo que nos hubiésemos podido imaginar, yo en lo personal, me pregunto cuánto del mundo médico puede lograr que haya una colaboración integral y global sin que los componentes políticos en realidad afecten eso, donde alguna vez podamos tener en algún momento una salud pública justa y que sea para la gran mayoría. ¿Qué componente político hay involucrado en esa parte médica? ¿O realmente ustedes han sentido que, un poco en tangencia con lo que usted respondía anteriormente, que sí hay realmente un apoyo global, dejando de lado las posturas políticas? Gracias.
Gracias, Maru, porque es una pregunta bien compleja, ¿verdad? Yo soy optimista y sí, como he mencionado, estamos viendo pues una pequeña luz que permita realmente ver que sí hay la posibilidad de llegar a ese objetivo bastante audaz, y se ve mucho también en de cómo ha respuesto la gente, obviamente los grupos de advocacy, ¿no? Pero tenemos todavía mucho que trabajar porque porque es cierto, dentro de quienes toman las decisiones, hay muchos que todavía no tienen la voz de poder realmente poder hacer los cambios. Y empezando por aún el hecho de que nuestros gobiernos, en nuestro gobierno estamos hablando también de los gobiernos de los países en vías de desarrollo, tal vez no tienen la audacia de realmente ponerse a sentarse realmente alrededor de la mesa y decir, yo soy la que, nosotros somos los que tenemos que también aportar a estas decisiones, y las decisiones ciertamente todavía vienen del Global North hacia la percepción de que el Global South es lo ideal para ellos. Ya estamos viendo un poco de cambio en el continente africano. Yo creo que Latinoamérica tiene mucha capacidad y se ha visto los indicios de poder hacer esos cambios, pero tenemos muchas dificultades que como son esas otras fuerzas que mencioné, ¿no? Toda la fuerza de los conflictos políticos que nos distraen completamente de lo que tenemos que hacer, ¿no? Y yo creo que ahí entonces va a ser un poco más difícil, pero yo creo que sí se puede, pero va a necesitar realmente a tener otro enfoque, y yo creo que tal vez es levantar la conciencia, y no es necesariamente, a veces pienso que, por ejemplo, nosotros donde tenemos más success es con no hablando con los ministros de salud o con las entidades en realidad de la salud pública, sino que es quien se tiene que convencer son los ministros de finanzas, los ministros de economía, los que realmente cambian las leyes, porque ellos son realmente los que pueden hacer estos cambios, y obviamente respaldados por el soporte y la evidencia de obviamente de la parte científica. Y yo creo que ahí donde podemos empezar es en, really where everything starts with this, which is in education, and not even higher education, early education, porque who makes this world is us humans. So the next generations are very important. And we have a trend that the new generations seem to be very interested in global health and this achievement of equity, but we need to be intelligent into guiding them and giving them the tools and preparing the world so that the world actually exists, so that they can eventually, make these changes for the better good, right? So very complex, Maru. I don't know if I answered you, but it's just some random thoughts.
Thank you, Dr. Bottazzi. You answered.
Gracias.
You answered Mario's question, and also it was Nurka Toro Diaz from Cuba. She had the similar question. I don't know if Jose Antonio Sabortiz from Mexico, you want to share your question publicly? Si quieres hablar, José Antonio, o leo tu pregunta. No lo veo en este momento. La pregunta de José Antonio era si tienen algún convenio con las autoridades mexicanas o hay el proyecto de que se lleve a cabo algún trabajo conjunto en materia de vacunación.
Bueno, nosotros tengo que decirle que tenemos años de trabajar en México. En hecho, nuestra vacuna de Chagas es puramente mexicana, tengo que decir, mexicana para Mesoamérica y Latinoamérica y Europa. Trabajamos con entidades públicas, privadas, académicas, y la verdad es que en otro espacio les puedo contar lo que estamos haciendo en el área de Chagas. Y sí he estado en comunicación porque tenemos obviamente la aspiración de crear una infraestructura pues no solo de Centroamérica, pero de Mesoamérica. Ya he estado en contacto con oficiales mexicanos, de nuevo y muy interesantemente, vía el ministro de Relaciones Exteriores, con el ministro Ebrard y con los diferentes comités, o sea que sí tenemos establecida la conversación, y México tiene muchísima capacidad. México tenía historia de ser muy buen productor de vacunas, se ha perdido mucho, pero tienen la aspiración tal vez de resurrect la capacidad de producción de biológicos de manera indígena.
Thank you. I have Sirana and then Yvette Toriz.
Hi, mucho gusto. I'm Sarana Bird, and I'm just in awe. I checked your website, and you speak Spanish, Italian, Portuguese, and English also beautifully. Okay, so there's so many questions, but one of them was, I know the rate limiting step for Moderna and Pfizer were at first the cold chain supply, like about keeping it cold and being able to, use up the vaccine in certain ways. Is that not as much of an issue because it's the technology that you're using?
Correct. We use recombinant protein technologies, very similar to the hepatitis B vaccine technology. They are very simple refrigeration strategies, and not only for storage and delivery, but also proteins have very long stability profiles. So you can actually make, for example, Biological E can make 140 million doses a month. And that 140 million doses, even though I think there's been some news recently where Africa is even saying, don't ship them to us because we can't deploy them fast enough and they're going to expire. The type of technologies we develop, even if they store them, they have long storage conditions. So you don't have to deploy them like now, right? Because they're going to basically go out of expiration. So there's a lot of that, benefit. The other thing that maybe is not as noticeable is some of the RNA technology also required some compounding and doing some manipulation by the pharmacist before you, of course, deliver. And these other protein-based vaccines, you basically, take them out of the fridge and you just, inoculate them. There's no manipulation, right? That you have to combine components or dilute components and things like that. So it's very well known because you use them for all the, pediatric vaccination schemes. So countries at least are aware of how to manage them and how to transport them. Ideally you want to develop vaccines that don't have any temperature requirements, but at least refrigeration is better than freezing temperature, right?
And then just kind of sustainability for Baylor. Usually when you're doing research, you apply for grants and then you have a product and then, you make money off of that or you sell it for money for a university and pharmaceutical partnership. But what you're doing is so revolutionary in the sense that you're open, no patents, and you're sharing the information. So who funds you and who says, like how do you do that?
Very, very good question. And I have to say, I think it's the privilege of being with Baylor and Texas Children's that they agreed to the no greed, right? To the fact that, but I think it came inherently because when they recruited us, we were very clear, right? We said, we develop vaccines that nobody really cares to develop. And therefore we need to remove barriers and incentivize our partners. Maybe at some level, we never knew we were going to be as successful as quickly. And of course, COVID-19 has given us the precedent that it can be done. But there's other ways that you can get recognized, right? And it doesn't necessarily have to come with, selling your technology or assuming royalties or patents are the ones who are going to make you money. I think we've seen it from philanthropic response, as our portfolio really is the fact that there's so many generous people that have said, look, we are going to support your activities. So our portfolio is heavily on philanthropic support, even a little bit crowdfunding, right? You can donate $10 and I can assure you, we can make your $10, really good use, right, of your $10. But also the fact that we think that the long-term payout is more important. If you eventually can give health to someone that eventually will be economically productive in society, eventually that will come back into paying our efforts, right? We may not see it in our, in our lifespan, but hopefully it's a legacy, right? And I think that's what we are, in for. And truly, I have to say, yes, our institutions are also getting recognition in other ways, right? The amount of time Peter Hotez has been on CNN and NBC and Fox and whatever.
And the Daily Show.
Right, and the Daily Show, with we don't get any money out of that, right? We don't do anything exclusively. But can you imagine if they would have to pay advertisement in those prime TV slots? So it's also free advertisement for an institution, right? And so therefore, there's ways that you can monetize and advertise, and so therefore our institutions are very aligned with what we want to do without necessarily imposing that the benefit that the return on investment has to come from the transfer of these technologies.
And my last question, I'm sorry, is just the accountability. So, you're providing the recipes and you're providing the, the basic ingredients, and that other companies are taking it on and reproducing it. What about if there's an injury, based on the vaccine? Who holds that accountability?
Yeah, very good point. And I think that's actually been one of the areas of, very, ¿cómo se dice? Un poco de pelea entre estos contratos entre las multinacionales, ¿no? Quieren de que alguien pague ese liability. La verdad es que nosotros damos la tecnología, pero nosotros no desarrollamos la tecnología. Entonces realmente el liability es del manufacturador, y ellos establecen esos niveles dentro de sus propias negociaciones con, por ejemplo, India, con el gobierno de la India, o entre ellos mismos, ¿no? De poder realmente determinar cuál es el riesgo que ellos tienen, ¿no? Por eso es otra razón por la cual seleccionamos tecnologías que ya son comprobadas y ya sabemos el perfil de seguridad que conllevan porque se han usado en otras enfermedades, y que ya sabemos cuál es el riesgo de algo que tal vez no sabemos. Y la verdad es que nada en la medicina, en la ciencia es fuera de riesgo, pero uno trata de minimizar esos riesgos, y por eso es que usando estas tecnologías ya convencionales no solo dan la confianza, pero probablemente también reducen el riesgo de aquellos que obviamente la van a producir.
Thank you. I had Yvette, and then I see Reina Rodríguez y Marcela Sarsotti-Kelso.
Hola, ¿qué tal? La verdad, ya me contestaron las preguntas, me las ganaron, pero me siento muy, muy contenta y muy orgullosa de ser latina y que esto esté revolucionando nuevamente. Hablaron y me pareció muy bueno lo que usted llamó, yo soy mexicana, de la vacuna que están haciendo, de la vacuna que hicieron Patria. Y bueno, me encantó escuchar la colaboración que usted tiene también con México, porque la verdad también sé que en México están a pasos agigantados para una nueva transformación para la humanidad. Me contestaron las preguntas, pero no quería dejar pasar que muchas gracias y muchas bendiciones.
Gracias, muchas gracias.
Estoy viendo que se nos está terminando el tiempo. No sé si la doctora Bottazzi capaz que tiene que correr a otra reunión en este momento, o si hay un tiempo para los otros comentarios que estaban.
Tengo unos cuantos minutos, no se preocupe.
Ok, entonces estaba Reina, que tenía un comentario.
Yes,
Yes, good afternoon. Hey, Dr. Bottazzi, thank you so much for everything that you're doing for the community. I work very closely with your brother, Gabriel Bottazzi, here in Winston-Salem, and I have a few questions. Why United States not supporting 100% with this vaccine here inside of the United States? And the other question is why, how we can do it to get the vaccine in our countries. I am from El Salvador, and I know my country is struggling with the vaccines most of the time, and a lot of people here inside of the United States and also in my country, they are afraid to get vaccinated because all the bad comments that we hear every day about the vaccines, and how we can do it with the community, how we can not convince to the community, how we can be, I don't know, that the community believe in the vaccine again.
Yeah. Again, very difficult questions. The question of the selection of the type of vaccines that were supported early on by the US, which again, they're very skewed to these technologies and have been fantastic because, as you know, many of us have been beneficiary of those RNA and even viral vector technologies. Of course, I can't go back and know why those decisions, but they are now seeing that the hesitance problem is an issue, and the intent is ideally, yes, maybe there are other solutions of how to bridge that hesitancy gap with maybe putting forth these other more conventional technologies, but there has to be a partner that would be able to, either produce the vaccine or that the government agencies agree of how eventually to accept vaccines to enter into the United States, which have been produced overseas. So it's a complicated, strategy. But I have to tell you, we are in discussions with the White House. Of course, then we had, of course, also a change in leadership with different approaches. They are contributing, especially there's a mechanism that it's called the Quad Summit, which is, with the United States participate alongside India, Australia, and Japan, I think, where they all have different roles. I know you've heard about donation programs. They're also supporting indirectly through removing barriers of supply chain to enable the manufacturers to be able to have access to the supplies, right? From supplies that are produced in the US. So it's very complicated. But to really answer the question of how we can entice our communities to those that are still hesitant of getting the vaccines, honestly, is relying on conversing with them and alerting them of where really the trusted data is, because there's a lot of confusion, of a lot of misinformation and disinformation. And so I'm sure, for example, Duke has very good, links to where to find the sources. Of course, our public health and state and city health offices, ideally are, a source of trusted information. Point the people to the right, direction, but at that same time, learn to listen what the issues are, share your stories, show the evidence that we now have, of course, millions of people that have been vaccinated, the benefit of being vaccinated that reduces the burden of, severity of disease, of course, the fact that the vaccines are really good at preventing deaths. So, I think it's really just, it's all in the communication, right? It's all in engagement and direct them to where the real trusted information is, and adapt it to based on, of course, for example, faith-based, access to information, work with the faith-based institutions, or again, societies or community organizations, right, that really know and understand, again, this concept of cultural intelligence.
Thank you. The next one was a question from Marcela Sarsori, Professor Marcela Sarsori Kelso. It was about whether Corbevax tested for efficacy against all new SARS-CoV-2 variants.
Yes, so the original studies were done against the original Delta Beta, and of course, we know the study was done before Omicron, so now they're retesting all the the samples against Omicron. There's a backlog because everybody, of course, is trying to do the same for all the different vaccines, but we have some hint within our, of course, of preclinical information that Omicron is a challenge, right? It's a virus variant that it's very transmissible, but at the same time, it's also slightly immune evader, right? That it's not, our vaccines are losing a little bit the protection, but fortunately, it's not losing enough to remove the value of the vaccine, even though they're vaccines against the original, virus strain. So I think we have optimism, and I think the key here is, again, focus on those regions that have not received any vaccine, because that's where the emergence of the variants come out of. And if we really squish that by giving benefit of protection in those populations, we're going to slowly see that this virus is going to eventually get controlled.
Thank you.
Thank you. I don't know if Ivan had a comment earlier. I don't know if Ivan is still in the chat. I know a lot of people had to go. Lots of comments and questions. Thanking you, Dr. Elena Bottazzi, for your information today. I don't know if Gabriela, Dr. Leonor Corsino, who was in clinic and couldn't reach earlier. Leonor, are you still here? I think so. Well, we want to really thank you for participating with LATIN-19 today, and for really giving a wonderful and enlightening talk today to our community. I don't know if there's any last minute comments before we close today.
No, just I put my email in the chat for everyone. So write me, I'll get to it. I promise. I have a backlog, but eventually I get to it. But feel free. Similar to how we're open access with our vaccine, we're open access. We always try to respond to as many people as we can, or we direct you to people who can respond on our behalf.
Thank you so much.
Thank you.
Gracias, doctora Bottazzi.
Muchísimas gracias.
Gabriela. Le conté a tu tía que te conozco y que ahora estamos en contacto. Estaba muy, muy happy.
Bueno, ahora no nos perdemos entonces.
Bye,
Un
Viviana.
almuerzo.
Bye, Alex.
Gracias a todos por
Gracias a
venir
todos.
hoy.
Adiós.
Adiós,
Cuídense.
Gabriel.
Gracias, Gabriel.
Bye, Gabriel.
Bye,
Bye,
bye.
everybody.
Bye.
Esto te